Question 1. During a busy afternoon shift, a sterile processing department, SPD, technician uses a barcode scanner to link a specific orthopedic set to a patient's surgical record. According to core industry principles, this information technology action primarily serves to A. Eliminate the need for biological monitoring. B. Support overall patient safety. C. Automatically update regulatory standards. D. Track the movement of the patient. Correct answer B. Knowledge point explanation. Core rationale. The ultimate and most critical goal of utilizing information technology, IT, in sterile processing is to support patient safety. By accurately tracking which instruments were used on which patient, the facility can rapidly respond to infection outbreaks or product recalls. Trap analysis. Option A is wrong because computer tracking does not replace mandatory biological testing, it only records the results. Option C is wrong because IT systems do not automatically update external industry guidelines. Option D is wrong because patient movement is tracked by a separate admission network, not the instrument scanner. Concept extension. While operational efficiency and financial tracking are significant benefits of IT systems, they are always secondary to the primary directive of patient safety. Question 2. A clinical educator is reviewing the capabilities of a newly installed tracking software. The software analyzes daily workflow data and suggests optimal times for staff lunch breaks to maintain high case card output. This advanced feature is best categorized as A. Clinical information registry. B. Standalone financial ledger. C. Decision support system. D. Quality of care indicator. Correct answer C. Knowledge point explanation. Core rationale. Comprehensive IT systems act as decision support systems. They collect vast amounts of data regarding processing times and workflow bottlenecks, providing managers with actionable intelligence to make operational decisions, such as staffing adjustments. Trap analysis. Option A is wrong because clinical information pertains to medical diagnoses, which is outside the scope of SPD tracking. Option B is wrong because while financial data is captured, a standalone ledger does not describe operational workflow optimization. Option D is wrong because break schedules relate to efficiency, not directly to the clinical quality of patient care. Concept extension. Turnaround time, TAT, is one of the most vital metrics analyzed by these decision support systems to prevent delays in the operating room. Question 3. Computer integration provides numerous operational advantages for modern healthcare facilities. However, which of the following is an established limitation of these integrated networks? A. They cannot eliminate the redundant entry of information. B. They do not provide automatic critical updates to industry standards. C. They fail to increase departmental efficiency during peak hours. D. They are unable to reduce conflicting information across departments. Correct answer B. Knowledge point explanation. Core rationale. A common misconception is that technology handles all compliance tasks. In reality, IT systems do not automatically update themselves when organizations like the Association for the Advancement of Medical Instrumentation, AAMI, issue new critical standards. It remains the responsibility of the personnel to learn and apply these updates. Trap analysis. Options A, C, and D are wrong because they describe the exact opposite of reality. Computer integration is specifically designed to eliminate redundant data entry, significantly increase efficiency, and drastically reduce conflicting information by acting as a single source of truth. Concept extension. The principle of garbage in, garbage out applies heavily here. A system is only as accurate and compliant as the knowledge of the technician operating it. Question 4. To accurately predict the demand for sterile instruments over the next 48 hours, the sterile processing manager needs to review the current patient census. Which interfaced hospital system provides this specific demographic data? A. Electronic medical record EMR. B. Centralized Patient Order Entry Network. C. Admissions, Discharge, and Transfer (ADT) System. D. Facility Financial Billing System. Correct answer C. Knowledge point explanation. Core rationale. The ADT system is the primary hospital network responsible for tracking patient movement, registering their arrival, and assigning rooms. Interfacing the SPD software with the ADT system provides the vital patient census data needed to anticipate the volume of surgical procedures. Trap analysis. Option A is wrong because the EMR holds detailed medical histories, not raw census movement data needed for instrument forecasting. Options B and D are wrong because order entry and billing systems handle medications and finances, respectively, not the physical location and census count of the patient population. Concept extension. All personnel interacting with data derived from the ADT system must strictly adhere to the Health Insurance Portability and Accountability Act, HIPAA, to protect patient privacy. Question 5. A technician logs into a basic computer software to verify if a large steam sterilizer operating at 270 degrees Fahrenheit requires its routine weekly inspection. This action demonstrates the system's ability to track A. Preventive maintenance, PM, schedules. B. Radio frequency identification tags. C. Departmental charge master codes. D. Social media communication portals. Correct answer A. Knowledge point explanation. Core rationale. A fundamental safety function of even basic tracking software is maintaining the logs for preventive maintenance, PM. By tracking equipment usage and service dates, the system ensures that critical machinery like sterilizers and washers are inspected before a mechanical failure occurs. Trap analysis. Option B is wrong because RFID is a hardware tracking method, not a scheduling function for equipment repair. Option C is wrong because charge master codes are used by the billing department to charge patients for supplies, not to maintain equipment. Option D is completely irrelevant to professional sterile processing operations. Concept extension. PM must always be performed by qualified personnel, such as a biomedical engineer or the manufacturer's representative, never by the SPD technician. Question 6. A sterile processing technician uses a barcode scanner to scan a laser-etched two-dimensional, 2D, data matrix on a single pair of 4.5-inch iris scissors. What is the primary operational advantage of tracking at this individual instrument level rather than the general set level? A. Identifying the real-time physical location of the entire enclosed case cart. B. Ensuring the specific surgical instrument is maintained within its strictly designated tray configuration. C. Satisfying the direct federal mandates established by the Occupational Safety and Health Administration, OSHA. D. Automatically ordering a replacement surgical scissor from the facility's materials management system. Correct answer B. Knowledge point explanation. Core rationale. Item-level tracking using a 2D matrix allows the Sterile Processing Department, SPD, to monitor the exact history and specific location of a single tool. This level of detail is critical for keeping instruments in their specific sets, locating missing items, and ensuring precise accountability for expensive or specialized assets. Trap analysis. Option A is wrong because a 2D matrix requires line-of-sight scanning and cannot track a whole cart's real-time movement like active radio tags. Option C is wrong because OSHA regulates worker safety, not the detailed tracking of surgical instruments. Option D is wrong because instrument tracking software does not automatically purchase replacements. It only alerts staff to inventory issues. Concept extension. The Food and Drug Administration, FDA, Unique Device Identification, UDI, system relies heavily on this permanent 2D laser etching technology to trace medical devices throughout their entire life cycle. Question 7. Information technology and tracking networks offer massive data-driven benefits to the modern sterile processing workflow. However, which of the following statements represents an incorrect assumption regarding the fundamental purpose of these electronic tracking systems? A. They are utilized to monitor the frequency of usage for specific capital equipment and surgical trays. B. They are implemented to assist departmental management with comprehensive quality assurance processes. C. They are required to strictly satisfy the direct tracking mandates of the Centers for Disease Control and Prevention, CDC, and OSHA. D. They are designed to ensure that critical mobile assets can be rapidly located within the healthcare facility. Correct answer C. Knowledge point explanation. Core rationale. While tracking systems provide excellent data that can be used to prove compliance during an audit, the physical act of electronic instrument tracking is not a specific, direct mandate enforced by OSHA or the CDC. This is a common exam misconception. Trap analysis. Options A, B, and D are wrong because they describe true, core reasons why a facility invests in tracking software. These systems actively monitor usage, assist in quality control, like linking biological indicators to loads, and rapidly locate life-saving equipment. Concept extension. Although not directly mandated by the CDC or OSHA, tracking systems are highly recommended by the Association for the Advancement of Medical Instrumentation, AAMI, to facilitate efficient and safe surgical instrument processing. Question 8. A busy hospital needs to continuously monitor the exact location of mobile emergency crash carts across multiple patient care floors without requiring staff to manually scan them. Which specific tracking technology provides this constant, real-time data update? A. Active radio frequency identification, RFID, tags. B. Two-dimensional, 2D, data matrix laser etchings. C. Traditional one-dimensional, 1D, linear barcodes. D. Manual paper-based preventative maintenance logbooks. Correct answer A. Knowledge point explanation. Core rationale. RFID technology utilizes radio waves to automatically communicate an item's identity and location to network sensors mounted in the ceilings or doorways. This provides real-time tracking data because it does not require a human to manually point a scanner at the tag. Trap analysis. Options B and C are wrong because both 1D and 2D barcodes are passive technologies. They only update the system's location data at the exact moment a technician manually scans them with a direct line of sight. Option D is wrong because paper logs cannot track the physical movement of equipment in real time. Concept extension. A real-time location system, RTLS, is the overarching network infrastructure that utilizes these active RFID tags to display the live physical locations of mobile assets on a digital hospital map. Question 9. A facility recently installed computer monitors and barcode scanning hardware directly at the 3-bay decontamination sinks and the clean assembly prep tables. This operational practice of integrating technology directly into the physical workspace is professionally known as A. Cloud-based remote processing. B. Point-of-use computing. C. Centralized admission registration. D. Outsourced vendor integration. Correct answer B. Knowledge point explanation. Core rationale. Point-of-use computing refers to placing computers and tracking hardware directly in the functional work areas where the tasks are actually performed, such as decontamination and sterilization areas. This greatly enhances data accuracy and workflow efficiency. Trap analysis. Option A is wrong because cloud processing refers to where the data is stored off-site, not the physical placement of the workstation. Option C is wrong because admission registration happens at the front desk using the ADT system, not at the decontamination sinks. Option D is wrong because vendor integration involves loaner trays, not the installation of internal computer terminals. Concept extension. In the decontamination area, these point-of-use computers must be carefully protected from water and chemical splashes to prevent hardware damage, often requiring specialized waterproof keyboards and covers. Question 10. An advanced instrument tracking software provides management with critical metrics such as technician turnaround time, TAT, tray financial values, and biological testing compliance. However, which of the following external pieces of information is not automatically provided by the facility's internal tracking system? A. The individual productivity output of a specific sterile processing shift. B. The preventative maintenance schedule for a 15-pound heavy-duty orthopedic drill. C. The automated manufacturer product updates and federal recall alerts. D. The precise historical record of a specific tray's high-temperature sterilization parameters. Correct answer C. Knowledge point explanation. Core rationale. Internal tracking systems manage the data generated within the hospital. They do not automatically connect to external manufacturer databases or federal agencies to download product updates or recall alerts. This external information must be received and acted upon manually by management. Trap analysis. Options A, B, and D are wrong because productivity reports, preventative maintenance scheduling, and sterilization quality assurance histories are the fundamental internal data points that an advanced tracking system is explicitly designed to collect and provide. Concept extension. When a manufacturer recall does occur, the tracking system is then used to rapidly identify which patients were exposed to the recalled item by searching the internal sterilization and usage history.